Hi everyone. We were supposed to start at 4, but Dr. Kunal got roped into the OT. I'm Kalpana Sharma. I take care of lifestyle, specifically health for E-Times. Hi, good afternoon everyone. Evening actually. So we were supposed to start at 4, but Dr. Kunal actually had to go for an emergency. So we'll just quickly Yeah, so we'll be talking about a very pertinent topic, which is, COVID and heart. So we know. Good evening, doctor.
Hi, good evening.
Good evening. I
I,
thought we won't be able to do it today. I'm so glad you've joined.
no, we just
Yes.
made it. Yeah.
Yeah. Yes. So, I would like to start with, this second wave. First wave was bad, but second wave totally took us all by surprise or rather shock. So, what was your experience like?
I think, not very different from what I think the rest of us encountered wherever we were,
Yeah.
whichever part of the country.
Right.
Because the good thing about the second wave was that it was uniformly merciless, right?
Absolutely.
It was merciless to the people, it was merciless to the politicians.
Yeah.
Now, it has claimed a good amount of common people as casualty, and now we are waiting to see that what kind of political casualty it claims. That will be a different part of the story.
Yeah.
We in Calcutta, you see, we were perhaps 6 weeks behind the Mumbai timetable.
Right.
Uh, and to us, we are definitely very sympathetic to what we were acting in sympathy. Initially, we were a little bit angry about what was happening in Maharashtra because to us it looked as if that Maharashtra had these couple of districts which were misbehaving for about a month and a half before that, and we were a little bit surprised at how something, a state as uh, kind of energetic as Maharashtra was failing to control that.
Right.
And then once it spread to Pune, Mumbai, etc., it was
Right.
very obvious that anything that comes to Mumbai, like a Bollywood hit, would come to the rest of India.
Yeah.
So
Yeah.
everything was waste of time, was a factor of time. And perhaps in Calcutta, it was kind of catalyzed. It was like a bit of an amplifier. The election was a great amplifier in the east. Uh, we had a hell of an election which went on for, I don't know, it looked more like 6 months. And history tells us it went on for 2 months.
Yeah.
And we had elections with us. So elections made things, and what elections did to the second wave in our part of the world is it spread it very much into the interiors of the state. You see, the first wave had not spread right into the interiors. And once hell broke loose with us from about mid-April, we were about 6 weeks behind Mumbai. I mean, obviously, hospitals and all were horribly overwhelmed.
Right.
And what where we could have done a bit better, where we were a bit lucky, is I don't know how bad the oxygen problem was, say, in Mumbai or Maharashtra. But Bengal, since we are located close to iron and steel facilities, where within a matter of 3-4 hours you have access of many sort of old-time big factories or what remains of them. So we were spared the oxygen agony. So we didn't have the oxygen trouble, not as much. So that was one problem less compared to Delhi. maybe from what I hear, I think Mumbai
Yes,
also didn't have a bit of an oxygen issue.
oxygen was an
But we
issue.
didn't have the oxygen issue, but we had serious hospital capacity issue because if you go city by city, then we have far less hospitals, especially in the private sector, and far less beds compared to. So that went on for a good amount of time. Uh, we opened up some subsidiary facilities, stadiums, uh, hotels, makeshift places here and there. But in course of this bitter struggle, the kind of good thing that we managed to do is we got our ECMO program really jacked up. During the first wave, we also ran a very active ECMO program. I think the highest number of ECMOs we did simultaneously. We did about 70 plus patients on ECMO during the first wave.
Okay.
We've already crossed 100 during the second wave. And we are running about, we've ran 28 ECMOs simultaneously. As we speak this afternoon, we have 22 ECMOs running. So I think, very modestly, that perhaps makes us the largest ECMO unit, at least in Asia. I have not checked out what's happening elsewhere in Europe or what's happened in US. But our ECMO unit did very well. It was hard work, but the hospital gave us a lot of encouragement. And ECMO in Medica, Calcutta is basically under the umbrella of the cardiac surgical department. So the critical care and the anesthetists of cardiac surgery were hand in glove, totally in possession of the ECMO unit. So it's not just having 28 patients on ECMO. Our total workforce dedicated to the ECMO unit, just to the ECMO unit, is more than 200.
Okay.
If I count the nurses, the physician assistants, the physiotherapists, nutritionists, junior doctors, so everything put together, the ECMO itself has a committed manpower of more than 200 people. It's been a tough fight because, like the rest of the clinical spectrum, see, people were really, really sick. I think two things stand out in the second wave is, like most of us have experienced, that this mutated virus, the Delta virus, as we are supposed to call it right now. So the Delta virus was in a great hurry. So what it was doing during the first wave, over a matter of weeks, it was doing exactly the same plunder this time, but over a matter of days. So everything was accelerated, the cytokine problem and all these things.
So,
And the
Dr.
other
Sarkar,
thing, yeah, and just one more thing, I think it is clinically relevant, is where I felt very sorry for our critical care and ECMO colleagues, is, they were really getting late referrals because by this time you had a lot of nursing homes and smaller hospitals who would have had access to high flow oxygen, BiPAP, and other stuff
right.
which they did not have the first time, which really meant that many of the sick ones were there in the referral hospitals for a week, 10 days, etc. So gone were the days when we were seeing people who were referred to us day 5, day 6, day 7. So that was all replaced with referrals from day 14, day 15, day 20, like that. So all in all, it was the outcome. It was a much tougher fight, but I think our boys have managed to do well. But I think when we get down to doing an outcome analysis between the first and the second wave, it won't be a lot down. In the first wave, we had a more than 50% salvage from ECMO, which compares with ESLO and other statistics. But this time around, I think we'll probably be on the lesser side of 50%. But
Also,
we did
Dr.
we did a lot more. We did a lot more cases. A lot more cases.
Something that I mean, we've been hearing that COVID is a disease, is a virus that kind of impacts your lungs, the respiratory system. But we have also seen that it's equally impacting the heart. In fact, a lot of discharged patients we've been recently hearing, post COVID recovery, even those who did not have underlying heart issues were actually developing heart issues and also some of them succumbing to it. So, what do you have to say about that?
Well, I think what is the date today? I think 8th of June, something like that, isn't it? So by the time we have come to the 8th of June, it is fairly well settled now that this was a kind of a lab designed virus, like your designer wear stuff. So I think the world is coming to grips with that story scientifically. And I think it looks as if that this little fellow was completely designed to blast out our lungs in those 10% of unfortunate cases who are who get out who are sadly not in the simple end of the spectrum. Uh, we cannot help but saying that this time round we actually saw far less obvious acute cardiac problems compared to the first one. Now, if we honestly speaking, nobody's had the peace of mind so far to sit back and do a systematic analysis of any sort. I don't think we cannot even pretend that. I don't think we've done that. But talking from perceptions and impressions, why have we not seen it? I really think, by the time we receive critical care and ECMO and ventilators and all that stuff, the poor patients had already been completely, their lungs had been blasted off. They were from the point of view of the pulmonary insult and the systemic insult, they were honestly far sicker. So did we not look? It can be a valid question that from the middle of all this forest fire, did we not look for specific cardiac symptoms? It could be a fact that the cardiac symptoms got buried under, a lot of other problems that were happening around us. In terms of the acute disease, we definitely have seen less problems. But I've seen something very interesting, which is we saw one patient during the first wave, and we saw exactly a copycat of one another during the second time round. And these two were conditions that were completely mimicking an acute infarction, acute heart attack. Right? So both these patients, separated by maybe 3-4 months, so they had come in with a terrible looking ECG, chest pain, all your blood markers, cardiac enzymes were high, and the cardiologist had chivalrously taken them to the cath lab, done an angiogram, because these are the exceptional cases where cardiologists have been given the remit to, to consider them as high risk, take them to the lab, do the angiogram. In the meantime, we can wait for the RT-PCRs and everything to come in. We do now have access to your, what do you call that cassette, that cartridge-based RT-PCR and a rapid antigen.
Right.
So both these times we had so far we've had these two people who completely mimicked a myocardial infarction. Then by the time they were being investigated, the RT-PCR came out positive and the angiogram was dead normal. Right. So there was nothing wrong in the coronary side. So they were treated conservatively. They got better. Both of them fortunately went home. The other very curious case, not curious, maybe curious for us, but not curious for the patient, is, all these business that we've been hearing about the thromboembolic. COVID itself has thromboembolic problems,
Right.
and that is the whole basis of COVID, as you know. But we've had another bit of thromboembolic concern following the vaccination, especially with Covishield.
Right.
So I had really, face to somebody who's had an angioplasty done to the LAD 8 years back, right, was doing perfectly well from the angioplasty. He had no complaints, fairly regular follow-up. So this gentleman, I think he was in his late 60s, he goes and takes the Covishield first dose. And within 48 hours of the Covishield first dose, the gentleman is crashing chest pain. And it was obvious he has had an infarct. And mind you, he was on, I don't think he was on very hefty dose of antiplatelets, but he was on something. There are some people, because they've done well for 7, 8 years, would stop all their medications. But this chap did not. So he was on medications. But I mean, it was a crashing anterior infarct. But good for him, he survived it. He survived it. His anterior, he lost a good amount of ejection fraction. The anterior wall looked pretty sad. And then after about another week or so, he had received the first dose. He was obviously COVID negative. Then in about 7 8 days, we had a chance to operate on him. He had some other lesions here and there. So we did 2 or 3 bypasses on him. His heart had taken a big beating. And then fortunately, he went home okay. The other thing, which regarding COVID and heart is important, and I believe, I forget where the review was from. This was once again during the era of the first wave. I think most of the experience was from China. It must have been one of the Chinese papers, which kind of echoed with all of us. Sorry, one was getting primary cardiac symptoms, problems like arrhythmias, high enzymes, myocarditis type problems. So a primary problem was the heart. The other spectrum, where I think people ran into very rough weather, was people with COVID with pre-existing cardiac problems. People who may have been on heart failure medication. For one thing or the other, it could be ischemic, it could be non-ischemic. I think people with cardiomyopathy did particularly bad with COVID. Similarly, if you look at the experience of people who've been maintained on, let's say, borderline heart function on dialysis, I mean, they were pulling along quite a few years with borderline heart function and dialysis. And whatever fragile balance they would have had, I think COVID just knocked it off. It knocks off the lungs. It completely kind of distorts your fluid balance, equilibrium, etc. And I honestly feel very few of those patients have been salvaged. So people who, I mean, if you were just a touch hypertensive or something, I don't think that was a particularly adverse risk marker. But people who had significant problems, especially I would definitely separate out the ones who were on significant anti-failure medications, but were doing well, were doing okay. They may have had low levels of activity, but they were pulling along. But these poor people, they decompensated thick and fast whenever their saturations would drop down. They didn't do well at all. That is another category.
Right.
And you did mention the long-term symptoms. I think so far we do follow up a lot of these people who get home on telemedicine. Again, we have to scratch our heads and find an answer why it happens. But almost invariably in second COVID, as in COVID 2.0, which is the second wave, I mean, in the second wave version, almost invariably everybody is tachycardic by the time they've been discharged. And in hospital, probably they were a little bit distracted, so then they didn't take much notice of it. So by the time they go home, they keep calling you every day to tell you Doctor, my heart rate is 100, my heart rate is 110, etc., etc. And I think rightly, because I mean we never, I mean, 'cause from the background of cardiac surgery, we seldom ever medicate patients for being borderline tachycardic and sinus rhythm. We almost never, in normal rhythm, we almost never do that. But this time round, I think, especially the younger patients who go back home and try to do some activity here, there, etc., move around the house, they get very tachycardic. It could be, I don't know what it is. Their echoes are not bad. We obviously have seen a few who's had heart failure purely post-COVID. They get better. They take about a month to recover. They get better. But I think I used to get very cross with people who were recommending medicines like imabrad and all these things to slow heart rate down. But this time there are so many of them that imabrad has almost become a routine medication by the time they've got home. Time will tell, time will tell why that happened. But once they settle down, they do okay.
Also, doctor, there's a thin, actually, for someone who's recovered from COVID, has had some level of pneumonia. So often the chest pain, which could be because of the lungs, and can also be because of an underlying heart issue that hasn't been diagnosed. So how do you really differentiate between the two? That if you are having this
So
chest pain,
could
is
be,
it?
could be. You're quite right. It's not an easy job to differentiate between the two. But we would, in order to differentiate, you see, cardiac lesions or coronary problems would not suddenly crop up overnight. You know,
Right.
so you are more likely. You've had a brush with COVID for about 15 days. You've gone home, especially if you've been into hospital. It really means that your disease was at least moderate. And if your disease was at least signifies it, that a good part of your lungs was affected in the pneumonic process,
Right.
consolidation, or whatever you would like to call it.
Right.
So that group, where, and if you've been into hospital, then obviously you would have had a CT as well. So where you have a good amount, your CT score was that 15 plus, 13 plus, 20-ish and all that, it means a good many segments have been affected. And especially you see people who have the lung bases, the basal segments affected, like our classical pneumonia of olden days. These people are very prone to get pleuritic chest pain. So pleural inflammation, pleuritic chest pain, possible that you could have had a touch of a secondary infection by the time you've gone home. So I think after catching your breath, etc., etc., clinically is more suggestive of a pleuritic chest pain. But the trouble was clinically diagnosed with ischemic. It's very common to have IHD, ischemic heart disease, scribbled on that many of our previous prescriptions. But these people may not have had a specific investigation. They may not have had an angiogram. They may not have had a CT before, not this time, but before. I think then you are caught a little bit in hesitation what to do. But if we have valid reasons of suspicion that, look, this seems to be more of an exaggerated angina, which was uh, sort of suppressed and uh, behaving all this time, which is creating mischief, then I think we have to walk the conventional path, either do a quick CT test or you can't really ask these people to do treadmill tests and stuff like that. So it's not fair. You can't do that. So if we have valid reason for suspicion, you have an access to a cath lab. If the kidney function and all these things are okay, get a quick angiogram done. And if not, get a CT done at least. But most of the time, if they've not had this bit of a hint about an ischemic heart disease before, it's unlikely that it will crop up all of a sudden. But then again, you've got all these funny business with thromboembolism and all that. So there are that many factors lurking in the background. If we have a genuine doubt, then it doesn't really sound like a post-pneumonic pleuritic chest pain. It sounds a little bit more mischievous. So then we better confirm it.
So what are the
Otherwise,
signs?
yeah.
What are the signs
Sorry.
that a COVID recovered person, uh, some signs that you can say that that it could be a heart issue, that they should get tested, because a lot of times people just assume. I hear it a lot that you
I
just.
would, yeah. I honestly think that anybody, so far I've not had the privilege of experiencing it myself, either at home or
I hope
hospital.
you
Oh, well, you feel a bit left out if you haven't had it. Because, yeah, you must have done something as to why is the virus being so unkind to you
what
for
will
the moment.
happen to us, doctor, if you start experiencing these.
So, I mean, especially during the second wave, it feels like you're left out of the party or something. So, anyway, but looking at these people, I think the best thing is that whenever we really have to caution those patients a little bit more in detail, is people who had a touch or two about a cardiac problem in the past. And once again, I would get back to the issue of people, who've been on diuretics, hypertensive, you've been managing them for heart failure for one reason or the other. I'm still a bit apprehensive about how these heart failure patients could they won't really run off the block as the other people would. And we really need to keep a close eye on them. And the other problem is here, a practical part of life is that when many of these people, they've spent about 2 weeks in a hospital, and especially if they've been in like an air-conditioned environment. I don't know what the weather in Mumbai or the western part of India is like now. We are having a very sultry uh, kind of weather in Kolkata. So whenever people get out of the air-conditioned ambience, they get home, they start drinking, they start taking water, gulping water down like a fish. There's no use telling them. There's no use telling them that restrict yourself to a liter and a half and all that. So they would have gone home in the midst of all these heat and humidity and drank 1.5 liters in a matter of, say, by the time it's 11 o'clock in the morning. And then their heart failure would get worse. So it's a bit of a chicken and egg problem over there. And so we as physicians, we as treating physicians, I think you need to have definitely a shorter leash, a more closer follow-up of this. Generally, you would say, take care, you report to your doctor about a week, maybe another follow-up after a month, and then you're okay, COVID is over, you slip through the net, you're a lucky one, tata, go home. But people who's in heart failure, I think we would definitely, uh, we would be, a better plan would be to do a closer follow-up, a better, well-knit kind of a follow-up, because it's a bit of a tricky situation managing post-COVID heart failure, what to say and what.
Also, doctor, there's one thing that most doctors are prescribing or people are self-prescribing, and that is blood thinners. So post-COVID, just everyone's taking blood thinners for several weeks, just for the fear of blood clot. So do you think that is actually needed? Do you feel that it is being you know there's not a proper prescription being done, people are also self administering it? What do you have to say about that?
Well, honestly speaking, I hesitate to nitpick on this issue because in India, our pharmacy sort of dispensing systems are such. You can go out to a pharmacy and buy a nuclear missile without prescription if you wanted to. So anything, anything, and especially if you have the right contacts, then you could probably buy the rocket as well. So it's not a, it's not a matter of prescription. It's a matter of contacts. Do
Yeah.
you know who I am, and
Right.
that's it. So we know that the real world is a little bit different. But if we see the trouble, this thromboembolic issues of COVID that has caused. So I think if people are popping in, say, about 150 milligrams of aspirin or something like an aspirin clopidogrel combination, there isn't much of an evidence to suggest that whether the clotting issues, the micro clotting issues with COVID are kind of prevented with this level of anticoagulation. We don't have any evidence to tell us. But honestly, you wouldn't do yourself any harm. Now, when you try to upscale your anticoagulants to things like Elquase, the reboxifene, or whatever you call it, I find it very difficult to pronounce these names. That when you upscale to the next sort of genre of anticoagulants, then I would strongly suggest that you get into, do be in touch with your doctor because you don't know what else you have by way of problems. It'll be a bit sad. Almost every alternate Indian suffer from some GI ulceration of one description or the other. Some of them may have had a previous history of a cerebral bleed, all these things. So I think, yes, we at this time, we are not hanging, we are really hanging on to very fine threads. So we don't have a whole lot of very clever evidence and markers in front of us. We are still between CRP and D-dimer and all this kind of stuff. But once we prescribe them, or anybody else prescribes things like the proper anticoagulants, I think we will have to be mindful that what other conditions the patient has. You don't want the poor thing to land with a GI bleed or a cerebral hemorrhage or something like that. But definitely, even if you are prescribed that, then do run it for a kind of average course of time, maybe for a couple of weeks or so. And when the
Right.
blood reports have settled, when the blood reports have quietened down, then I think the doctor would gradually wean them off. Then you want to continue aspirin for a few more weeks, you're welcome to do so. If it does you no harm, and it does the medicine shop a lot of good. So fair enough, it contributes 2 rupees to the economy. So in these struggling times, it's not a bad idea. But I really think, once we have really got a lot more insight into the nuisance of the thromboembolic problem with COVID, then
Right.
then we can rationalize. But a lot of
Also,
COVID, honestly, is still like the Da Vinci Code. Really, we still don't know what we are dealing with.
right.
Yeah.
And also, now with the vaccination, a lot of people are claiming that they've had a spike in blood pressure post vaccination. So have you also been hearing such cases? And if that's normal, how worrisome is it for heart patients?
You see, honestly, I think people get very anxious before vaccination. I mean, those of them who had a close encounter with COVID are probably a little more relaxed because they've had a meeting with the real thing, so they're not afraid with the vaccines as such. And the people who haven't, they really get a little bit of worked up before the. And I've known people who started bathing early in the morning as if they were going to a puja or something before the vaccination, and having a very rigorous diet for the last 2 days. Some people have started fasting and stuff like that. So you don't need to get into all these rituals. Hypertension is really not something, if you get terribly tensed up, then it's a separate matter. Hypertension is really not associated with this. the real point of confusion, which I have faced a few times trying to advise people over the phone, etc., is that you had a shot of a vaccine, then you come back home, and then you have a fever for a couple of days. Then what do you interpret that as? Do you interpret that as a post vaccine fever, or have you managed to uh, pick up a couple of pieces of virus in your vaccination center? What have you done?
Yeah.
So that is a cause of a worry, the what exactly you're dealing with. But I don't think the clinical approach would be a lot different. And you tell them to hang on for a couple of days with your usual paracetamol and stuff. If it goes away a few days, fair enough. If it does not, do an RT-PCR and say where the land lies. So that is one problem I've seen quite commonly, people, because you see a good amount of people have actually, you see, some of them may have felt a little bit queasy a couple of days before the vaccination, then said, ठीक है, and gone and got the vaccination. And then they had the fever. So you don't know which way it was. You don't know which way it was. So, but if the post-vaccination fever, etc., persists for more than a couple of days, I think get a test done so you know what it is. So that is one issue. A bit of the drug rashes and allergies, a bit of a scratch and a rash here and there. So far, I don't know whether we've picked them up or we haven't picked them up, because like in India, out of the 24 crore odd vaccinations we've done so far, I think 80% or so, which is more than 16 crores or so, would be Covishield. So that's a
Right.
huge amount. I think India perhaps by this time would perhaps have the world's largest data of Covishield usage. No, where I'm coming from is what I meant to say is, thankfully, neither have we read or nor have we picked up these, cerebral venous thrombosis, and that too in young women. So, have they got lost in the crowd? Have we really not seen them in India? Not sure. Because you see, with the very limited number of Covishield they used in Europe, and it's after this business of this sagittal sinus thrombosis, etc. It happened in the worst place to have have a complication is in Scandinavia, because in Scandinavia, even if you have a pimple on your cheek, that gets reported on a national database, and the whole country would be jumping up and down about it. So it happened in Scandinavia with a very they weren't really very high users of Covishield, but it happened. Now in India, I get a bit surprised that because this was supposed to be the kind of flickering red light with Covishield vaccination.
Right.
Have we really not picked it up, or has it not happened? We don't know.
Okay. Anything else, Doctor? People who've been in hospital, had a mild infection, a severe infection, how can they take care of their heart? I'm sure you must have heard this question several times. But what is this
Look, I think
post?
just take like take care of yourself overall. You can't take care of your heart separately, kidney separately, brain separately. So just take care of yourself. You'll be okay, and we can draw a little bit of comfort from the fact that whoever was the crazy fellow who put all these amino acids together and designed this mischievous virus on the bench did not program it for the heart. Because if it did, I don't know whether it would have been less trouble or more trouble. Perhaps little less trouble, because at least for heart you have a few solutions. For lungs you have nothing. So it's not really picking up the heart and hitting it in the way it is completely. It's got the lungs in its bullseye. So whenever it decides to cause some a nuisance, it has a great love affair with the lungs. So it doesn't have the same romantic liaison as far as the heart is concerned. there may be some cardiac side effects, you may feel a bit of a palpitation or two now and then. It'll all settle down. Do a routine standard checkup like your pulse rate, blood pressure that you would normally do. Your doctor would definitely advise you to keep up with your some few medications, respiratory exercise, and the rest of it. And look, since what is the treatment of COVID? The treatment of COVID, in my mind, is that we people being in a dark, deep jungle with a small little pencil torchlight in hand, and we are shining the light immediately on a few things in front of us, and we think this is the fellow. So we are not really seeing the big picture in COVID so far, because that crazy group who designed this virus even didn't even know the entire list of problems it could cause. So I think we will get better at treating it. We definitely got better through the first wave. I think all the doctors, especially the young ones, I think COVID has been a battle won by the youth, not not by people with gray hairs and growing ears like myself. People like the old hags like myself, so-called senior members of the faculty, have all sat in the different committees and made a mess of the policies. But the battle on ground has been won by the young people, the young doctors, the young nurses, the young physiotherapists. And I feel very guilty getting to the COVID ward. I go a couple of times a day because I look at these youngsters, and the message it conveys to me is how stupid I was in their age and how much better they are than me in these times. Right. So they've won the war for us. Acknowledge it. And don't get too tied up about it. So far the heart is not a dreadful issue. Be very careful. If you were taking heart medications before for breathlessness or a bit of a lazy heart or reduced ejection fraction, all it means is that you need to run a check more often, more frequently. And I would tell you that be in touch with your doctor once a week over the first month or so. And once things settle down, you can get back to your own regular rhythm of follow-up.
Also, doctor, one last question. They say that, people have been monitoring their blood pressure and pulse rate. So what exactly, blood pressure, we know that's 110 and 80, the latest number. But, when it comes to pulse rate, how much is okay? And when is the time that you should start worrying?
See, pulse rate is a funny issue. Any story about pulse rate reminds me of a story about, what is a normal human pulse rate? So when you used to read your biology books in class 4 or 5, probably nowadays they read biology in class 2 or 3. We used to read them in class 5 or something like that. And the ballpark figure for normal pulse rate was around 70 to 80, right? So for a normal human being, the fitter you are, the lower is your heart rate.
Right.
So the heart rate basically is titrated with your capacity to take stress absorption. I've never tested it out. People say all these yogis and sadhus who go into meditation, there are people who can stay alive with your pulse rate of around 20. You don't try that. With 20, we would have died 3 times over. But one thing I know for a fact, don't ever try to repeat that experiment. But one thing I know for a fact is, that those of us who remember, people, Bjorn Borg, he was a won Wimbledon 7 times or something. So Bjorn Borg, after the 5th set of a classic Wimbledon final, I think it was with Jimmy Connors or something. So somebody got curious because people knew on the side that Bjorn Borg is, unbelievably fit. So this ball boy went and I said, Mr. Borg, can I count your pulse rate? So he said, yes, try it. So at the end of 5th set of Wimbledon, Bjorn Borg's pulse rate was 50. So this is how fit that man was. So please don't try to do that. It means you and I will have to exercise 48 hours a day, which is not possible. So for a normal human being, maintain an average height, weight. Don't put on weight for God's sake. That is the last thing you can do in this environment. Aim to have a pulse rate around 70, 80, that's fine. 70, 80 is pretty good actually. In urban living, with the kind of stress levels we carry, because I think anybody who's not stressed at this point of time should see a doctor, because stress is almost like a fashion accessory. We have to wear. Everybody tells, I can see your stress, you can see my stress. I can't see my stress, you can't see your stress. So stress is a bit of like a lateral inversion in a mirror. So you don't see what happens to yourself. I don't think, if you get a little bit anxious or stressed, it may get up to 90s. It's not entirely normal to run three-figure pulse rates. Some people do, but very few and far between. And the other thing important is, especially if you've had a bit of infection and all that, you see, normally our body is so programmed. As you and I talk, the heart is beating. Now, heart is a very humble, silent worker. Is it announcing all the time that I'm working? In an average day, you have between 1 lakh to 1.5 lakh heartbeats, right? The heart is doing all this work for free. No holidays, doesn't stop, no strike, no buns, no dharnas, nothing. It will stop once and that day we are gone. Tata bye bye. We are gone, we have left the earth.
Yeah.
So from birth to death, there's no rest. So there will be fluctuations, but one thing for sure, in a matter of health, when the heart works, it never announces itself. So if suddenly you become aware of your heart rate, that is called palpitations.
Okay.
Whatever is normal for you, for you the normal may be 75, for me the normal may be 80. Right. But the moment I am aware of my heart rate, tuck, 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 it is going, it would mean that it is going at 120, 130. There are certain queer conditions where the heart rate can be very fast. It's called these tachycardias and all these things. But the moment you get really aware of your heart, that you can feel that fellow thumping on your door, that is not normal. And that is the time when you need to have a quick word with your doctor that, look, this is funny, I've never had it before. So how come the word is like going all hammer and tongs right now? Why is it doing so? There are a number of causes for that. And that the doctor, because in normal health, you are never aware of your heart. You will be aware of your heart rate like you ran on the treadmill for 20 minutes, half an hour. Yes, you've exercised.
Right.
You've stressed.
Right.
So then you will feel it because your heart rate is normal than usual. But if you're just sat down, reading a book, working, watching telly, something, and suddenly you get aware of your heart rate, that this chap is going hammer and tongs at something, then don't take that lightly. Have a quick word with your doctor. They'll do a ECG, etc., check it.
So Soumya, doctor has answered your question almost. And there was another question on, can aspirin cause excessive menstrual bleeding in women?
Honestly, aspirin is not a very vicious drug. But whenever you see, first of all, if you take aspirin, you must be taking it for a reason. Normally, people are giving aspirin because if there has been a suspicion of some clot somewhere or some heart attack or heart problems. But the short answer to your question is, if you're on aspirin and you have excessive menstrual loss, then I think the first step would be to stop aspirin.
Okay.
Because aspirin would not per se cause the bleeding, but the natural process with which the bleeding could stop can be hindered by aspirin, because the whole effect of aspirin is it makes these little cells we have called platelets, it makes them somewhat lazy.
Right.
So with any kind of bleeding, people sometimes complain that I'm having dark stools, black stool. That is indicative of some blood loss from the stomach. So even then, the first thing your doctor would tell you is that it's probably a good idea to stop the aspirin. So yes, if you're having excessive bleeding and you've been on aspirin for some reason, it may be a good idea to stop it. Uh,
Okay.
then have a word with your gynecologist. They would tell you whether you really need the aspirin, you don't need the aspirin, what to do with it. Your gynecologist would tell
Okay. Uh, Last, doctor, I would like to ask, COVID aside, what is the way that we can stay, keep your heart pumping? Because a lot of doctors say that, 45 minutes of moderate exercise, something that takes your heart rate up, is essential every day. So, what's
you.
your take?
You see, the way I look at it is, first of all, we are what we are. So each one of us are probably have a little bit of peculiarity about ourselves, about where we live, what we do, how we move, how we have to put bread on the plate. So try to be yourself and don't try to be someone else. So if you try to be like somebody like Amir Khan, who's putting on 20 pounds and taking off 20 pounds every week, then you and I would suddenly end up looking very stupid. So don't do that. So in our framework, the first thing to do in today's world is don't make things worse. So do not aggravate any condition. And the first thing about that is, things like well, that you and I can monitor ourselves. The thing that makes things worse is uh, things like smoking, things like weight gain, right? Things like increasing your waist size. So
Right.
we've not been to shop for a pair of trousers or something fashionable for years, but when you do go the next time, so anything that you and I can monitor ourselves simply at home without
Right.
the doctor is equally important. Monitor your body weight, monitor your waist size. You know, suddenly you picked up smoking for God's sake, do stop it because you don't need to get out in the market and buy something poisonous for the lungs. I don't know how much a cigarette costs, 4 rupees, 5 rupees, something, because there is enough of the stuff in the air given to you courtesy China for free.
Yeah.
So when all this toxic stuff is available for free, why waste your money on it? If you take your lungs off and take 100 breaths, then you are very likely to get more problem. You need not go out to the shops anyway. So don't do stupid things like that. Then you see, I still haven't met anybody who's getting younger. If you have, then pass me the number or the WhatsApp number. I'll have a chat with the fellow. So since all of us are putting on in terms of time and years, it is important to keep the body in a working condition.
Right.
So do have a activity or a workout schedule, which again has to be your schedule, something you like to do. Right.
Right.
Now, yeah. So it may not be everybody's cup of tea to wake up 5:30 in the morning and go for some, leisurely walk down a couple of lanes or paths. Well, if you can, you're welcome to do it. If not, get onto a treadmill or do gym in the evening or do whatever, swim, anyway. And I'm addicted to swimming. Now I can't do it. 2 years, 1.5 years, I've not hit the pool. So be yourself. Ask yourself what you would like to do. Uh, and don't be like the mischievous schoolboy who answered. He was asked, "What do you would like to do?" He said, "I like to be lazy." No, don't find excuses like that, because be in complete realization of the fact that none of us are getting younger. We are just a bit of a biomachinery. So there would be creaking in different parts of the body. There is bound to be certain wear and tear. So take care of it. Be mobile. Don't make things worse for yourself. And in your situation, in your circumstances, whatever you think, this is something I like to do, this is something I can do, and these are the ways in which I do not make matters worse for myself. I think that is a common man's life. That is a common man's life. And if you're not a Superman, don't try to be a Superman, because that's a very painful exercise. Don't even try to be.
Thank you so much for taking out time, doctor. I know we pulled you out of an emergency almost. So thank you so much. And
No, no, you're quite all right. And it was so nice to have spoken to you. And take care of
yeah,
yourself.
thank you
And
so much.
good, yeah, good luck for the third wave. And meet you again at the other side of all problems.
Yeah.
Thank you. Take care.
Okay, thank
Take
you
care.
so much.
Good.
Take care. Bye
Bye.
bye. Thank you for joining us, guys. Bye bye.
Thanks.